Waist level.
Table at
Waist.
All right. For this wound, it's a pressure sore, which means that he probably got this because he's not really mobile and moving around. So for the most part, in reality, you will probably be with somebody doing this wound because you have to turn him over. There's probably no way you're going to be doing this by yourself. Okay. In 111, you learned or will learn that when you turn a patient on his side or her side, you cannot turn the patient away from you. Okay, you always have to be on the side you're turning the patient, or you have to have somebody else on the side that he's turning towards. So for the skill, we're just going to pretend whoever's testing you will be that second nurse so you can turn the patient away from you. I'm not going to expect that you come in, there's just not enough time, and do the whole procedure for putting the patient on this side when you're by yourself. Okay, we're going to have pretend there's two nurses here. Okay? Okay, this is going to be on his buttocks. Okay. So we're going to turn the patient towards the other nurse. Make sure you always bend your knees and make sure the bed is always flat when you move a patient. Not move a patient if the head is up, and it just makes it too complicated. I want to have waterproof pads. However, they come in the hospital. You have these disposable ones. You have those big pink chucks. Whatever's there, you want to place that because we're doing irrigation. I don't want the linen to get wet. So I don't want to have to do a whole entire bed change after I do the dressing change. Okay. Same thing, the red bag, I'm taking off dirty dressings. If this is a regular dry sterile dressing and the tape is sticking, then I go ahead and apply saline to remove the tape easier. If it's a wet to dry dressing, which we're not testing on, I'm just giving this for your own knowledge. After you can just forget about this after I tell you. A wet to dry dressing means they take a soaked 4x4 or whatever in saline and apply that soaked dressing to the wound. As it dries, it adheres to the dead skin. So that when I take off that dressing, I'm debriding it and removing dead tissue. So if that's the dressing the patient has and I'm having trouble with the tape and I come in and soak it with saline, then when I remove that dressing, it's not going to remove anything. It's going to be wet, and it's going to happen for nothing. Okay, so that's the only reason why I want you to know you only will apply saline to the tape if it's a dry, sterile dressing and not a wet to dry dressing. Okay? And again, if you can remove this layer by layer, and again, check the drainage. 4x4 and packing. You're going to roll out this bed. Okay, again, my gloves. It's cuffed. So once you get the cuff, tie it up and put it aside until you're ready to leave the room. Okay? Now my supplies. I'm doing a combine, so it looks like a rectangle. This one I'm using tape for. So a rectangle has two short sides and two long sides. So I want to pre-cut my tape because once I have my gloves on, I'll be fighting with this roll of tape trying to get it not to stick to my gloves. So just cut off your 4 pieces and 1 extra piece for what?
Emergency.
For date, time, and initials. That's good.
Well, in case one gets stuck and rolled up, right?
That could be. All right, this is a bulb syringe. I'm going to take it out of the container. I don't care how you get it out. Just don't touch the green bulb. Okay? Touch anywhere but the green bulb. Because once I do when I need to use this to clean, I'm going to have one in my hand. Sterile gloves. So if I touch it now, and then I go to do my cleaning with my sterile gloves, what's going to happen to my sterile glove? It's going to be contaminated. So get it out any way you want, just without touching the green bulb. Okay? Put this aside. This is going to collect the drainage, and it's going to take up too much room on my table. This thing has a little plastic thing on the ends. That's how you'll get it out of here. Okay? Because I have to put what in?
Saline.
And I'll do all that checking of the information that I told you about earlier before you use this. Okay? Testing. They make these really cheap. So maybe a lot of times you'll come to get tested and you're going to find that these 2 little plastic things are stuck inside the bottle. So I will let you just check that before we start testing, because then you're going to be saying, oh my God, now what do I do? How do I get that out of there? So it happens. It's not your fault. All right, so we'll just check all that. All right?
What if it topples over?
Well, then I'd say that you have to recover your patient and go get another one. If it topples over, that green bowl, but I've never had that happen.
Oh, good.
Just to let you know. Now you know everyone's bottle is going to topple over. But I've actually never had that happen. Okay? In testing ever. So, that'll happen. Okay. I'm going to have a sterile field, like we did before. Okay, it's folded. I'm going to let it open once. Okay, folded side, and you see how the side's open? That's the side that will be facing me. Okay? And lay it down. And come over and make it small. I just have to put this in the order that I'm using them.